Hello guys, I am Anis Amira and you are watching Global News. The top story today.
COVID-19 have become a very surprising phenomenon for Malaysia today. Many people have died in our nation as a result of this deadly sickness, given the fact that there are more and more cases increasing every day. This has made the local afraid to interact with the outside community. According to the Centre of Disease Control and Prevention, 2021, COVID-19 is a disease caused by the virus named SARS-CoV-2 that was discovered on 31 December 2019 in Wuhan, China. It is very contagious and have quickly spread out around the world. And for the record, Dr. Zhang Jishen is considered to be the first doctor to report the novel coronavirus before its outbreak.
For more information, we continue with Sharina and her team.
Thank you. I'm Sharina. The origin of COVID-19 outbreak in Malaysia can be traced back to the first case arriving on Malaysian shore on January 25, 2020, when a passenger from China entry route via Singapore was tested positive for the virus. Since then, a historical new chapter unfolded, shaking the pillar of the national public health system and ultimately testing the perseverance of the nation as a whole.
First 3 cases of COVID-19 in Malaysia were import cases, were detected on tracing and screening after communication from the Singapore Ministry of Health that 8 close contact of a confirmed case of a Chinese nationality in Singapore had travelled into Johor, Malaysia.
As you can see here, this is statistic of coronavirus that increasing by years. Malaysia has been recorded about 5 million cases until December 2022. The graph also shows that the total corona death in Malaysia also increased by month until this December.
This coronavirus disease have 5 major variants detected, which are Omicron, Delta, Alpha, Beta and Gamma, which some of them differ in symptoms. For the Omicron, my headaches for several days. Delta, my headaches, fever, persistent cough, sore throats. For the Alpha, fever, shortness of breath, cough, fatigue, change of sense of taste or smell. Beta, my headaches, fever, persistent cough, sore throats. Gamma, my headaches, fever, persistent cough, sore throats.
In facing the current economic crisis amid the COVID-19 pandemic, the Malaysian government adopted a strategy that includes 5 approaches. First, a firm action and resolve in controlling the spread of the COVID-19 pandemic by implementing public movement control. Secondly, build economic resilience through a stimulus package known as Prihatin to improve people's economy, regenerate or restart the economy on a structured and controlled basis. Implement economic recovery strategies in facing the new normal. Last but not least, strengthen or revitalize the economy for future sustainability.
As a Malaysian citizen, we need to follow something that we call the new norm, which are
Getting tests for COVID-19 if needed, following recommendation for what to do if you have been exposed, staying home if you have suspected of confirmed COVID-19, seeking for treatment if you have COVID-19 and are at a risk of getting very sick. Make sure to maintain a distance of at least 1 meter from others, wear a mask, especially in public space, avoid the crowded area, confined space, and close conversation. Make sure to maintain personal hygiene at all the time by washing hands with soap or sanitizing area. Get vaccinated as soon as possible if you have not been vaccinated yet.
As COVID-19 has turned our world upside down, of course our country affected by it. In terms of economic impacts, Malaysia has lost 2.4 billion ringgit Malaysia a day during the MCO period, with an accumulated loss of 63 billion up to the end of April. Since May 4, Malaysia has relaxed the MCO and opened up its economic sector to relieve its economic burden.
In terms of technology, Malaysia developed an application called My Sejahtera, which is an application developed to assist in managing the COVID-19 outbreaks in Malaysia. It allows you to perform a self-health assessment, monitor their health, wearing mask or respirator for daily use. Masks are made to contain droplets and particles that you breathe, cough or sneeze out. A variety of masks are available. Some masks provide a higher level of protection than others. Maintain distance between people around us. Small particles that people breathe out can contain virus particles. The closer you are to a greater number of people, the more likely you are to be exposed to the virus that causes COVID-19.
Thank you for watching Global News. See you next time.